So welcome to my lunch and learn about forecasting. A little bit an introduction. Why am I talking about forecasting? Because it's been really a core part of my whole career. I started my career at Amgen. You see here some outdated business card from 20 years ago with still fax number on. And in the business planning and market research area. So this has been always my topic. Later, when I was at Roche, with a team, I won the Olympiad Award. We did a forecasting across the whole portfolio of the cancer drug Avastin, and did a strategic planning for that. So this involved forecasting. I also joined some years ago this Good Judgment project, where you can do also geopolitical forecasts. And with this, I ended up in the end in the German popular science magazine Welt der Wunder, because I was one of the few people who predicted that Trump would win the 2016 election. And this was on this Good Judgment project. So some journalists contacted me about that. And this talk is also going to be a paper which will be in the International Journal of Applied Forecasting next year in first quarter. So yeah, I've done a lot of forecasting in my career, and that's what I would like to share with you. What is forecasting? So it's basically the process of generating product forecasts in the industry to support decision making. And this can be for all sorts of different reasons. It can be to prioritize in research and development. It can be for supply chain planning. So to know how many factories you have to build, how many raw materials you need to buy. And of course, very important in the whole marketing and sales and commercial area to do forecasts in order to know how many sales representatives you need to assign to a project, to a product, to plan your marketing and sales budget, and also to evaluate your strategy, which products to invest in or invest more in or less. And then, of course, in the financial markets, it's also very important to have a forecast of the pipeline of products to do valuation of pharma companies. So, but it's more an art than a science. And as this quote says from Niels Bohr, prediction is difficult, especially about the future. So if you predict an event that has already happened, that's easy. But to see what's really going to happen in the future, this is quite a challenging task. What types of forecasts do we have? So there's the volume forecast or production forecast. So there you are forecasting grams or kilograms or milligrams, or depending on the setting of the active pharmaceutical ingredient, and also stock keeping units or packs or vials, syringes, tablets, also all these kind of things of forecasts I had to do in my career. Then there's the financial forecast, which is actually where I worked more on than on the supply chain forecast. And this can be also have many forms. So can be a sales in local currency, consolidation currency. That's usually the revenue is the starting point, but then you might also look at COGS, cost of goods sold, production cost, R&D cost, marketing and sales cost. With those data, you can then build a profit and loss account. You can calculate all sorts of ratios, R&D, marketing and sales ratio, and so on to sales. And then importantly for valuation, you can calculate net present value, internal rate of return, and return on investment. So this is the two key types of forecasts that you have. And by the way, anytime, probably Christina will see it as well. If anyone raises the hand, let me know, or just shout if you have a question. Then you can look at the forecast by by granularity. So first is the stage of the product. Is it in the market, or is it a new product? So usually you will have, for an in-market product, you will do a short-term forecast, so the next 24 months. If you have a new product, usually look on a long-term horizon because you want to see, what the net present value will be and what the clinical development costs will be in comparison to what the sales and the profit will be. So that's an important distinction in market versus new product. So there are differences there. Then market versus product. So are you forecasting one product, or you're forecasting a whole class of products? So let's say in breast cancer, you're only forecasting one breast cancer product, let's say Herceptin, or you forecast all HER2 inhibitors. That would be the forecast for the product class. Or you forecast the whole market, all the chemotherapeutics, all the different targeted therapies that there are, all the hormone therapies. That would be a very big work to do all of that. Usually you will do a product forecast or a class forecast. Then it can be really any time frame, can be daily, weekly, monthly, or yearly. Usually it will be monthly or yearly, but if you work on a country level in a pharmaceutical company, very often you're also asked to do a weekly or even a daily forecast. So then the whole time frame is important. Is it a short-term forecast, typically more for in-market products, or is it a long-term forecast that will be above 2 years, up to 15 years? That's usually more for strategic purposes. And then the geography, how granular are you going on the geography? Are you just doing a US and rest of world forecast? Or so with the biggest market and then the rest of the world? Or are you breaking it down more by continents? You say US, UK, EU4, Japan, and then rest of world. Or a level 3 forecast. That's the forecast where you actually go into full detail, and you have to forecast 40 countries. So when I was at Amgen at the European headquarter level, we very often did even a level 3 forecast down to each individual country. So let's go to the short-term forecasting methods. The easiest way to do a short-term forecast is just take a ruler and extend the trend. So that's basically linear regression. You see the formula there. So you start with a basis and then you just go up linearly every time period, every month or every week, plus your error term. Then you can become more complicated. You can use also multivariate linear regression if you want to look at different factors, different independent variables, not just the time. But the normal way would be to do the linear regression just based on the time. So that would be the simplest trend forecast that you can do. And most programs like Excel, they have this function built in. So it's quite easy to do. Then the second type would be curve fitting or nonlinear regression. So you're looking at what's happening and you don't want to just put a straight line. You want, for instance, let's say it's an epidemic like we recently had, then you would use an exponential function for fitting your curve and for looking at how your patients and ultimately also how your sales would develop. So this is then much more flexible in terms of what you can do. But of course, you need some kind of hypothesis which mathematical formula you're going to use, exponential or different curve, logarithmic curve or logistic curve, which we will see later on. And I will share those slides, so you don't need to write anything down. Then next, the final way how actually, I would say in practice nowadays, short-term forecasting is usually with time series analysis. So the simplest one you're probably familiar with, this is moving averages, where you add up 6 months or 3 months, and you just smooth out the weekly or the monthly trend to a smoother line, and you take that trend for forecasting, and you see the simple formula there. Then next version is exponential smoothing, where you give more importance to the more recent months in the forecast than to months that are maybe half a year or a year ago. There's also a formula for that, but I didn't want to give too many formulae here. Then what's very important is if you look, for instance, at drugs that are used for seasonal diseases like the flu in the winter, it will be important that you look at a seasonal decomposition. So you look at your basic trend, but then you also look what's happening in the winter months. There will be a higher demand for your flu product. So then you have your basic trend, and on top of that, you build your increase for the winter months. So that would be a seasonal decomposition. And then there's a so-called ARIMA model, where you look at repetitive trends in the time series. There's also a formula for that, and many statistical packages have that already built in, so you can run a ARIMA model on your data. And the latest, of course, is using artificial intelligence or machine learning, that you just give the whole trend, the whole structure of the data to the computer, to the machine learning model, and then the machine learning model will do the forecast based on the trend, how the machine learning model sees the trend. And one example is Facebook Profit, which was developed by the data scientists at Facebook. And this one you can actually download. I think it's free of charge, and use on your time series data. What's important for the short-term forecasting, and sometimes forgotten, is that the computer or the formulae and the algorithms, they will only write the past into the present and into the future. But you might know about some important event like patent expiry, or a geopolitical event like the war in Ukraine, where you know, okay, my demand in Ukraine for drugs is going to go down because the distribution is going to break down. So you need to build those events also in your short-term forecast, because otherwise you just have a forecast which will not be very precise. So that's all I wanted to say about short-term forecasting. I don't know if there are any questions so far. Otherwise, I'll switch gears and I'll go to the long-term forecasting, which has been really a focus of my career. I've been less involved on the short-term forecasting than on the long-term forecasting, because that's really what you do in strategic planning. So the main method that I have used throughout my career is the patient-based forecasting model. There's also a flow model that you can use for forecasting, where you actually have also flows that can go back and forth and so on. But that's a lot more complicated to use, and I have not really seen that used in practice by pharmaceutical companies. This is more, I would say, of academic interest. Usually, pharmaceutical companies use this method for long-term forecasting. And so what you do, so here expressed with this mathematical formula, so this is not the number p, that's a multiplication. So what you do is simply multiply all the numbers that you see here on the screen from the beginning to the end. And you start with your epidemiology, so your prevalence. Then you look at how many patients are eligible. You look at treatment penetration. You look at patient share, treatment duration, dosage, compliance, price, and then you look at as a result, you get the sales. And usually that's done in huge Excel spreadsheets, and you break those spreadsheets out into tabs by time. You have the time, and then you have the geography. So you will have usually a forecast by country and then add them up in the end, because it makes sense to measure the parameters on a level where you can really measure them, because the average market share for 5 countries is not a very meaningful number. So usually you break it all out by countries, and then you do as many years as you need for the forecast, or as many months. And this can be done in a big Excel sheet. Sometimes there are some Visual Basic programming on top to make that easier. So that's the basic structure of a long-term forecasting model based on patients. And now that's really an important slide. Where do you get all the data from? So typically, you would get the data for the patients, for the prevalence. You can also use incidence or mortality in certain instances, but in general, the method is based on prevalence. So how many patients have been diagnosed with the disease and have not been cured yet, or have not died yet. So this is the usual input here, and you will get that if you have your own epidemiology department. In big pharma, you get that from your epidemiology department. If you're in a smaller, maybe biotech, you have to do your own research or get some help to get the epidemiology data. Especially challenging for orphan drugs, where sometimes you don't have a good published epidemiology. So sometimes there you might have to go out and do your own epidemiology studies to determine that. Then the percent eligible and accessible patients, that will come typically from market research department, and also your treatment penetration. Usually there are data that you can buy to find it out, or you have to go into your own primary quantitative market research. And then the most important parameter in such a forecast is, of course, your share of patients. And this mathematical formula is the one that I have used the most, which gives you this S-shaped curve, which can be nicely parameterized with these 2 parameters, alpha and beta, so that you can have a very steep uptake or a very slow uptake, depending on what the result is that you expect. And most important parameter is your peak share. So what will be your peak share in the forecast? So that one I have a separate slide on. Usually you get by a type of market research study, which is called conjoint analysis, where you simulate different parameters of the product and the choice of in this case, it's usually the physicians if it's a prescription-based drug. And this will give you your peak share. Of course, this is also something that you will usually, as a forecaster, negotiate with your marketing department, what they consider a realistic peak share. Another source of peak share can also be analog data, but there you have to see if you really have a good analog. Otherwise, it's better to go out and do a fresh research. Yeah, I think we can see the slides. I think someone is asking, but I think most of you can see the slides. So I'm going to continue. But yeah, shout out if you have a question. If it goes too slow or too fast, let me know. Then the important input, of course, into the peak patient share will also be the clinical data, so especially efficacy and safety, because that has to go into your market research. So usually you will do that detailed forecast during phase 3 when you have really robust, or at the end of phase 3 when you have robust clinical data. And then, of course, also real-world data will be very important to see once the product is on the market, is the efficacy the same as in the clinical trial or not, and the safety, and that might also change in the end your expectation for the product. And of course, dosage and compliance will also come from real-world data and clinical data. And finally, the price will come from market access. Of course, also the percent eligible and accessible. I probably should have done an arrow from the market access department as well. And that's, of course, as we all know, getting more and more important. The market access is getting more and more important than in many markets than the physician choice itself. So that's a really interesting work, because you really have to talk to so many different departments to put your forecast together. A short explanation to conjoint analysis, because I think I mentioned it before, and maybe some of you are not familiar with it. So conjoint analysis is a well-established method for estimating peak share of a product. So what you do, you break down your product into the attributes, so efficacy, safety, price, and then you have different variants of your product. So maybe same efficacy, but higher price, or lower price and better safety, or higher price and better efficacy, and so on. And then the physicians have to choose between these different product variants. And from this, you can then calculate the share in the market. So you will also, of course, simulate all the competitor products in this way. And so you have a good understanding of how the physicians make the choice of the different or prescription of the different drugs. And so you can look at what are the more important parameters. Is this a market which is more efficacy driven, or more safety driven, or more price driven? This is the method. So this could be a whole separate talk. There are many different methods of conjoint analysis, but this is really a key study that you usually do at the end of phase 3, a key market research study. With all this, it's really important to look at the impact of events. So most important, of course, for your forecast is going to be the regulatory approval and the reimbursement approval. And this is something that you have to look at with the respective departments. When is regulatory approval expected? When is reimbursement approval expected? And reimbursement approval, of course, again, then it's important that you have a forecast by market, because there will be a whole sequence of events of reimbursement approval in Europe, not just one central approval like the regulatory approval. Then on the flip side, the patent expiry or loss of exclusivity, you will need to know when that is expected. And you might do some competitive intelligence also to see how many people, how many companies are entering with a generic. So that's very important. Then, of course, a key event is when the pivotal trial results come out. Then you have much more clarity about how to simulate what the product performance will be. And then another thing where I often had to do a new forecast was, yes, the product was on the market, but there are new results, new clinical results, either from your product or from the competition. So you need to actually look at, probably my peak share is going to go up or down based on whether the results are positive or negative. And then, of course, indication extension. So that's a big work in forecasting. You actually have to do a whole new forecast. So you will not do that in your old forecast model for, let's say, breast cancer. If you have now indication extension into lung cancer, you will do a whole new forecast. Then marketing and sales investment is, of course, really important to look at in terms of forecast. There we get into the really difficult area of econometrics. It's not really easy to estimate how a marketing and sales investment will impact your forecast. But one thing what you can do with the sales force is look at if you have a sales force territory which is empty, where there's because of maternity leave or illness or whatever of the sales representative, then you can look at what are the sales, and then you see, okay, this is the impact of the sales rep, and this is the carryover rate from the previous year, from the previous work, and from all the clinical data and so on, why the physician is prescribing this drug. And so this is one way of looking at the impact of the sales force. And such carryover rates can be very high for prescription-bound products, 70, 80%. So the actual work of the sales representative is the last 20% to the 100%. Then it's important to look at share of voice. If you're a smaller company and you're competing with a Pfizer or a Takeda or a Roche, you might not have the same share of voice in the market, and this will actually depress your market share. If everybody has the same share of voice, more or less the effect of marketing and sales can be competed out. And now it's all shifting, which makes it all even harder to quantify. Some companies are only working with medical sales liaisons. They don't have a sales force anymore. They are shifting more to digital and social media marketing. So this one is even harder to quantify. So you need to look at those quantification of those investments as well in your forecast. So with all this uncertainty that you have in a forecast, it's of course important that you don't just do one forecast and say, okay, in year 2026, we will be selling 1.5 billion of this cancer drug. It's more, that doesn't really help anyone. You really have to better understand where's the risk. And for this, a classical way is to do scenario analysis. So you create a low, medium, high, or low, most likely, and high scenario. And how I've done that very often is to do a so-called Delphi session. So you put all your experts from science, R&D, clinical, medical affairs, and marketing and sales, commercial, into a room, and you go through each forecast variable and build this, what I call a straw man. So you build a low, medium, and high assumption. You also, of course, put the scientific or other source there and a comment so that you have it all well documented. And with this, you can then do scenario planning. You can combine different assumptions, or you can combine all the low, or the medium, and all the high assumptions. And that really helps you to understand better the range of possible outcomes and I would say the risk and uncertainty in the forecast. And this is a manual method. The downside of this method is that you are not really looking at the probability of each occurrence between low and medium and high happening. And so there's another method which I can go into, but I would like to maybe stop at this point to see if there are any questions at this point. Or if it's too fast for you, I can also slow down a bit. Don't seem to be any questions. So like I mentioned, this method is good, is a good starting point, but you can take this a level further with a method which is called Monte Carlo simulation. And how does that work? So you basically take your each variable in the previous slide, let's say peak patient share, and instead of just giving one number or three numbers, low, medium, high, you give a whole probability distribution of that number. And there are tools, plugins for Excel that you can use, like from different companies. And then you say, okay, I expect a normal distribution starting from this value going to this value with a medium of this value. And you input all these different probability distributions for all the different parameters. And then the model will again do the multiplication and calculate the sales forecast. But it will not do it once. It will do it like 10,000 times or 100,000 times. And then give you this output here, which you see. So you will have a distribution. So you can say, okay, there is 97.5% probability that my forecast will be below this number here under 80,000. And you can see what's my most likely. So this gives you a better overview. And this is especially helpful for supply chain forecast, because there you want to be sure have enough, produce enough material, produce enough drug, and yeah, for them it's been especially helpful, but it's also helpful for strategic decisions, because I guess it doesn't make sense to plan for something which has only a 1 or 2% likelihood of happening. So this is, and what you can also do with this Monte Carlo analysis or Monte Carlo simulation is you can actually look at sensitivity. So you can look, if my market growth is 1 standard deviation less than my medium forecast, or 1 standard deviation more. I think this less should be to the left, not here to the right. But so basically you can see what's the impact of the different forecast variables. And of course, like I said before, the peak share will always have the biggest impact normally in a forecast. So this sensitivity analysis is important, because you will invest a lot of time on those parameters in terms of research, market research, that have the biggest impact. So if you have a parameter which has very low impact, you shouldn't spend a lot of time getting that super precise, because that's not a very good investment of your time. So that's another output from the Monte Carlo analysis, which I find very helpful. Now I'd just like to mention a few principles of forecasting. So what is good forecasting? How does that look like in my 20+ years experience? And how does bad forecasting look like? So what I always found good is to have a forecasting group in the corporation that doesn't really have skin in the game. So it can be sitting in finance or in market research, but ideally not in sales or not at the general management, because these are people that have a vested interest in having a very low forecast. Usually in the countries, I have a very high forecast, usually in the headquarters. That's the usual fight. And so I think no skin in the game is actually good in that case. Then most forecasting is still hard to believe. 40 years after Excel came first on the market, is still happening in Excel spreadsheets. And so make sure to really audit your spreadsheets, because I haven't seen any big Excel forecast that didn't have some errors somewhere. So this is just good housekeeping. Also keep them very clean and color formatted, and so that when you hand over your work to someone else, that they can actually work with it. Because I often got forecasts where I had to just do it again from scratch, because I completely couldn't understand how the model was built. Then the famous quote from Galilei, make everything measurable. So that's really important. Sometimes people will tell you, oh, we can't measure this. Well, test this assumption, test the assumption if you cannot get the epidemiology for an orphan disease. Maybe there is some quick, usually not quick way, but maybe over a year or so, a method that you can use to get at least some estimation of the epidemiology. Then the Occam's razor is really important. I've often seen that marketing, especially once all there are different patient share segments and customer segments in a forecast, well, you don't have the patient share for the customer segment ABC usually, or patient segment. You don't have the peak patient share. You don't have those data. So if you create this granularity in the forecast, you will actually make it less precise. And so don't multiply those entities. Just do one German forecast or one forecast for France. Don't do 20 forecasts for 20 patient segments times customer segments, because it's just going to make it less precise. So this is a good principle, I would say, for any forecast. Then better to be roughly right than precisely wrong is a great one also. So let's say if somebody asked you, when was Mozart born? You can just say between 1492, the discovery of America, and the beginning of the First World War, 1914, you're going to be right. But if you want to say exactly when in the 18th century, you're probably gonna be wrong. So try to get it precise, but not too precise, because then you will be wrong. And the final thing is the quote from the philosopher Heraclit. You can never put your foot in the same river twice. So be aware that your forecast model needs to be flexible. You need to be able to change it 2, 3, 4, maybe 10 times a year as new events come in, and not only once when you do the budget or the long-term plan. So I think these are good principles. And the flip side to that would be the bad forecasting. So just going out there, starting a Excel model and not knowing any of the parameters, just start guessing. So that's not a good way. Another not good way is to have just a black box. So you have some Excel spreadsheet with a lot of Visual Basic on top, and you actually don't know what it's doing underneath. So you hire a consultancy and they build some complex model that you don't understand as the forecaster in the company. And then when the head of marketing, of strategic marketing, comes to you and says, hey, why has this forecast now gone up by 20%? You can't say why. So that's kind of the anti-Occam's razor. Don't do just single point forecast and fake precision, saying in 2030 our sales is going to be 200.57 million in France. So that I wouldn't do. And then politics always gets in the way with forecasting, between headquarter and affiliates, between different departments. I guess this is inevitable, but try to have a process which takes a little bit care of this. So for instance, when I was at Roche, they had what was called the Forecast Management Review Board. And this was someone from the market research department that was chairing that, who had no skin in the game, as it were. So they were just looking at how was the forecast done. And you had to, any forecast for any strategic decision had to go through that board to get the stamp of approval. And I think that was a really good way, which prevented that certain actors could just go ahead and say, okay, now we're going to do this forecast in a week, and this will support my decision. Then I mentioned already, inflexible models is a big problem, that you build huge model and then some key points change in the real world, and you cannot adapt the model to it. So keep it flexible. I already mentioned spreadsheet errors. That's of course the easiest point. Another one that I really like is the Monte Carlo fallacy. So, if on the Monte Carlo, on the roulette table, if there's 20 times coming red, then some people think, okay, now I have to put it on black, because definitely after 20 times red, black will be coming. But this is, of course, a fallacy, because there are these variables, these probabilities are they are independent, so you can't assume that. And I've seen often such flawed argumentation. Then another one is rare events. So rare events sometimes tend to cluster. So if you put coffee beans into a cake dough when you make the cake, and then afterwards you cut it into the same pieces after baking the cake, same size pieces, you will see in some piece there are 3 coffee beans, in another one there's no coffee beans. So this is what's happening also. Let's say you can have actually a clustering of cancer cases close to an atomic power plant, but that doesn't mean that the atomic power plant caused the cancer cases. They will just cluster somewhere, and they can by chance cluster next to the atomic power plant. So do not assume clustering of rare events has necessarily some causal reason behind. So this is another sort of fallacy that I've seen quite often. And if we're talking about rare events, of course, there's the famous book, Black Swan. So, of course, it's hard to predict almost impossible to predict the black swan, but assume that a black swan might happen. So there might be something which is very improbable, which may have a huge impact on your forecast. So that's another important thing to think about. Maybe I make another break here and ask for any questions. I think we're still good on time. Good. No questions. Let me go a little bit to trends in pharmaceutical forecasting. 10 years ago, as I mentioned, forecasting was done only with Excel spreadsheets. I think now it has changed. So there was a survey last year by IQVIA, the market research company and CRO, where the responders, pharma forecasters, said that they now use a combination of spreadsheets, but also cloud-based solutions. So there are more and more cloud-based solutions coming up, cloud-based forecast tools, and also cloud-based tools for data visualization. I personally have used Tableau a lot. And there's also Power BI. So that's coming more and more, and everything is cloud-based. More and more forecasters are using, according to this IQVIA survey, real-world data, currently 69%, to update the forecasts on what's happening in the real world compared to when they plan the forecast with just the clinical phase 3 data. And yeah, forecasters say they use it, the machine learning and artificial intelligence, but it's mainly used in real-world data processing and in time series analysis. So it's not so much used yet in long-term forecasting. I think we have a Christine is asking, how does the forecast differ when assessing business development opportunities? I guess you mean in-licensing opportunities. I think the difference is, in my experience, is that you have less data. And for instance, when I was at Roche, sometimes I was actually contacted by the business development department, but they were usually very economic because there was kind of with the data, because there was kind of a Chinese wall or firewall between pharma partnering licensing, and on the other hand, our forecasting group, which was sitting in the market research group within strategic marketing. So we had limited data to work with. So I think even more important becomes the scenario planning, and looking at the uncertainties. And another thing with business development is usually you have to be really fast. I mean, when you work on an inline product, usually you have months to prepare a detailed forecast. Sometimes you update it over years. They are usually your internal clients want the result within a couple of weeks, typically. So that's what I would say is the difference.
May I add something here, Robert? This is Karima speaking.
Yes, please.
Because I've been in, in this position of doing forecasting in BD&L roles, and indeed, the time pressure is much. You have to come up with a forecast in much less time, and most, as you said, less data most of the time. But an additional complication is that you usually include at the end of your model your share of the sales forecast versus your partner share. So you have the additional layer of looking at the partnering and contracting condition. So you add your milestone payment, you had your potential royalty payment. So there's all these contractual and elements of the BD deals which are added at the end of the forecast.
Yeah, definitely. I think there's also a question by Chris. How you determine the distribution? Yeah, that's an excellent question. For the Monte Carlo, that's actually difficult because you don't have usually the full detail on that. So you have to make some assumptions, and you have to be careful not to get into the kind of fake that you apply Occam's razor also to this. So only put distribution for values where you really have a detail, and it's not so easy to get the distribution. But you can use this what I mentioned before, this Delphi session as the basic point for that, and for instance do a triangular distribution. So start at 0 with the minimum, 0 probability with the minimum value, then maximum probability with the most likely value, and then go down to 0 again for the highest, for the upside, with a triangular distribution. That's the easiest way to do it, to put basically the strawman as a triangular distribution into the Monte Carlo. I think Eva has also. Do you assign any degree of certainty that a forecast will work with 70%? Well, I mean, this degree of certainty you can get from the Monte Carlo analysis, but it's actually interesting that very often there is not really a sort of post-mortem being done. So like that you go back 5 years later and look if your forecast was right. I mean, there are many famous examples of forecasts being wrong, not only in pharma, but in general in the industry. I mean, now classical case, so now very recent cases is with, I guess, with Ozempic, that probably Novo and others, this whole GLP-1 drug class, that at the moment they can't even make enough. So this means for me that probably the forecasts were too low. But yeah, you can use the Monte Carlo simulation to assign a degree of confidence to your forecast. Yeah, I think this slide are pretty much I covered. I think important is here to say that forecasters don't think they yet have a high sophistication in AI, which probably true for the whole pharma industry. So these are the trends. Here are some books that I recommend. So this is the guide for business modeling from the Economist books, where I had, for instance, this logistic curve from. It's a really good one. Then the standard work for forecasting for the pharmaceutical industry is from Arthur Cook, who worked in pharma industry and then later became a principal at ZS Consulting. So this is pretty much the standard book, and I think also the only book that I know that speaks about forecasting specifically for the pharma industry. Then there is this book from journalist Philip Tetlock about super forecasting, basically what makes a good forecaster. So it's more about the psychological elements and about how to become a good forecaster. This one, and then probably everyone knows this one, Black Swan from Nicholas Taleb. Although he blocked me on X, but I still I still recommend this book. It's a great book about the impact of highly improbable events. And yeah, that's it. Thank you very much. I think we still have 5 minutes for questions. And yeah, through my company, if you need a forecast, a small plug for my company. So if you need a forecast, you can always contact me and we can talk about it. Also, not only the forecast itself, but also what supportive market research you would need to build the forecast. So yeah, I don't know if there are any more questions. Eva is asking what degree of certainty is satisfactory for pharma. This is probably a question I could almost give to the whole group. That's hard to say, but because ideally you would like to have your 90% confidence, but then there are famous cases. I don't really want to name any products and companies, but there's been a big pharma company who had a slimming drug 20 years ago, which they completely overestimated. There are other cases where for instance, the Actelion, the original product Tracleer, was very much underestimated, and only when it was very well known what the epidemiology of pulmonary hypertension is, then it became clear that that's actually a huge product and became a $2 billion franchise in the end, which was originally seen as less than 100 million Swiss francs. So worldwide. So I think ideally you would like to have a high degree, but it's not always achievable because of all the uncertainty about clinical trials, about nowadays also, I guess, about market access as well, very much so. I can maybe stop the slides. Yeah, Matthew, yeah, good question. I don't know how to include a black swan in a forecast, to be honest. Because yeah, I think this is more like a footnote than you couldn't just say, okay, now I wipe out my forecast because this black swan is going to happen, because it's usually still very unlikely. But I think in terms of scenario, it's more like question, I think less for the Excel forecast, probably more for a topic like wargaming or so, to think, okay, what could happen, or what could the competitor do, or what could happen geopolitically that will have a huge impact on our product, on our strategy. So I think it's more probably on the strategy level. So that's what I would say to this.